Understanding COVID-19. This video is brought to you by AgSafe, with the support of the Western Center for Agricultural Health and Safety, UC Davis, as part of the statewide program to create and disseminate educational materials related to COVID-19 health and safety. This video series will include the following topics. Number 1, understanding COVID-19. Number 2, COVID-19 protections to minimize risk. Number 3, seeking help for COVID-19. This video on understanding COVID-19 will cover the following. What is COVID-19? The most common signs and symptoms of COVID-19. Who is at greater risk and how it spreads? What is COVID-19? COVID-19 is a new disease caused by a new coronavirus not previously seen in humans. Coronavirus are a large family of viruses that are common in people and many different species of animals. COVID-19 can cause upper respiratory illnesses. Symptoms of COVID-19. If you have COVID-19, you may have symptoms that range from none to severe. If you do have symptoms, they will usually appear 2 to 14 days after exposure to the virus. A serious problem with COVID-19 is that the people that are infected but have no symptoms at all can still carry the virus and spread it to others. Some of the more common symptoms you should be aware of include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, diarrhea, seeking emergency medical attention. If you experience any of the following signs, you need to seek emergency medical care immediately. Call 911 or call ahead to your local emergency facility. Let the operator know that you are seeking care for someone who may have COVID-19. Let healthcare providers know that you suspect your illness may be COVID-19. Signs of COVID-19: trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, pale, gray, or blue-colored skin, lips, or nail beds, depending on skin tone. Who is at greater risk? It is important to remember, however, that anyone can get sick, but in general, older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes can be at higher risk for developing more serious complications. How it spreads. Now let's talk about how COVID-19 spreads. COVID-19 spreads mainly through close contact from person to person, primarily between people who are physically near each other less than 6 feet apart. When people with COVID-19 cough, sneeze, sing, talk, or breathe, they can produce respiratory droplets. The droplets can range in size from larger droplets to smaller droplets. Small droplets can also form particles when they dry very quickly in the airstream. Most of the infections occur mainly through exposure to respiratory droplets when a person is in close contact with someone who has COVID-19. Respiratory droplets cause infection when someone inhales them or they become deposited on the inside of the nose and mouth. As the respiratory droplets travel further from the person with COVID-19, the concentration of the droplets decreases. Large droplets fall out, and small droplets and particles spread apart in the air. Spread by airborne transmission. Smaller droplets can stay in the air for minutes or hours, and some people may inhale those infected droplets. This kind of spread is referred to as airborne transmission. There may be some conditions that people can get infected even when they are over 6 feet away, such as in enclosed spaces that have inadequate or poor ventilation. Spread through contact with contaminated surfaces. Surfaces and tools can become contaminated when touched by an infected person or when respiratory droplets land on such objects. It is possible that a person could get COVID-19 by touching surfaces or objects that have the virus on it and then touch their own mouth, nose, or eyes. However, spread from touching surfaces is not thought to be a common way that COVID-19 spreads. Review. In this video, we have discussed the following. What is COVID-19? The most common symptoms, an emergency treatment, and how COVID-19 spreads. Remember, we all have to work together to prevent COVID-19 from spreading. Do your part by wearing a face covering, washing your hands, keeping your distance, and getting vaccinated. Disclaimer. The content of this video is based on publicly available information. Such information is subject to change without notice, may be incomplete or condensed. Except where otherwise indicated, the information provided is based on matters as they exist as of the date of the video. Such information is provided as general information on the topics presented. Nothing presented in this video constitutes legal advice or opinion to participants or others viewing this material and is not a substitute for professional services. Every situation is different and subject to legislative activity and administrative or judicial changes in the law. Also note that the views or opinions expressed in the video do not necessarily reflect the views or opinions of AgSafe or express or imply compliance approval by UC Davis. This video was brought to you by AgSafe, with the support of the Western Center for Agricultural Health and Safety, UC Davis, as part of a statewide program to create and disseminate educational materials related to COVID-19 health and safety, funded by the State of California Labor Workforce Development Agency.